I noticed in your introductory statements you said this lower rate of admission may be attributable to the lower age profile of patients that has characterised the resurgence in the disease over the past months. It is, however, also an international phenomenon that's been experienced in the United Kingdom and I think right across the Western world. Is it something that's being studied, or are there any other explanations for it other than it may be attributable? I mean, are you happy to attribute it to the lower age profile, or is this being studied?
There has been much observation internationally, as you point out, of the lower rate of hospitalisation and some suggestion this represents a change in behaviour of the virus. But the virus has been sequenced in Swiss studies and the overall diversity of the virus hasn't changed. There's no new variant and there's no development of some less severe mutation. So the most likely explanation for this trend we're seeing internationally is as follows. We know the virus has a steep age-dependent rate of illness and mortality. And so the more testing you do, particularly in younger people, it will result in an imbalance between tests and hospitalisation. We have seen in this country, as in other countries, that a predominant shift towards positivity in younger age groups. The CEO referenced that 71% in the past 2 weeks are less than 45 years of age. It may also reflect, Deputy, that older people are behaving more cautiously, and as such are less prone to the illness as they were when we knew less about asymptomatic transmission, the mode of transmission of the virus some months ago. But nevertheless, the big caveat and warning at the end of all that is that there is a lag time between seeding within the community, between open outbreaks in communities, such as in some counties or where there's high levels of transmission, and a lag time between that and inevitable community transmission leading to older people.
So what's that lag time? Disease. What is that lag time?
The lag time is that the incubation period of the disease is 7 to 14 days.
I mean, we've seen this increase in testing for longer than 7 days now. I mean, it's the spike in detected cases now. I mean, I suppose we can never know what the transmission rate in society is. We can just know what's detected. But the increase is a lot longer than 7 days, and it hasn't been accompanied, thankfully, yet at least, by any increase in admissions and deaths, thankfully.
Yes, Deputy, and as I pointed out, the evidence does not show a change in the behaviour or the way the virus is. There's no new mutation. So the most ready explanation is that of the younger predominant rate of positivity among younger people, and perhaps the behaviours of older people in terms of avoiding risk.
Thank you. Thank you very much, Dr. Henry. Thank you for that. Obviously, hospital overcrowding is a recipe for disaster if it's accompanied with an increase in transmission of COVID-19 in the community. UHL is consistently the most overcrowded hospital in Ireland. I've heard from the previous Minister for Health and indeed Dr. Liam Woods, who's a senior member of your team, that there were plans to scale up the services being provided in Tier 2 hospitals so that to alleviate overcrowding in UHL. Yet we haven't really seen any sign of that yet. Can you say where that's at and when we're going to see an increase in procedures being carried out in the Tier 2 hospitals such as Nenagh, St. John's and Ennis to alleviate the numbers who have had to presenting at UHL?
Deputy, I think in terms of where we're at in that area, as you've rightly said, we've been very challenged over recent years, not just during COVID, in terms of the capacity in the Midwest. We have been working closely with those sites in terms of scaling up. I think what's important to note in Limerick in particular is that we have capacity that is now coming on stream. So we have the sports arena that opened for a short-term bridging period, but we have additional beds opening on the site of the main hospital over the coming months. So that is actually going to make a very significant difference to that area. Also, what I would say, as part of our planning for winter and next year, we've done a very extensive modelling exercise that shows the impact of all of the different proposed investments. But in that area, the beds that are coming on stream are expected to make a very significant difference. And I'm aware that the clinicians in that area are also very committed to looking at what initiatives can be driven in a more integrated way. And certainly as a part of the country, it could be used as an example for very good integrated working between community and acute services.
But specifically, when are we going to see increased procedures being carried out in the Tier 2 hospitals? Because we were told that would be the case.
In terms of it, I'd have to look at it. I don't know the dates.
Can you provide that to me in writing,
work on
perhaps?
that.
Can you provide that to me in writing?
We can look at that, yeah.
Thanks, I appreciate that.